Around here, there's a bunch of crooks around here.
You ain't supposed to be in that jail, boy. Get out of there, man.
No, that's a total no, man. VAT coming.
Is my salary going up?
Bahamian people gotta wake up.
This is my 5 cents and I approve this message.
Foreigners who reside legally in the country to be eligible for national health insurance. A body found in a track road off Cowpen Road takes the murder count up by 1. And Junkanoo voted the Caribbean's top celebration. We've got those stories and more coming up tonight. I'm Dana Smith, and MB12 starts right now. Topping news tonight, non-Bahamians who reside in the Bahamas will benefit from national health insurance. That was revealed by Minister of Health Dr. Perry Gomez during a press conference to announce the national consultation on universal health coverage this morning. This, as Gomez says, a N.H.I. report has yet to be completed. Our Jasmine Brown has the details in this report.
Officials today revealing a few details about the N.H.I. plan, but they did reveal that once implemented, it will also cover non-Bahamians. But Gomez says it would also cover foreigners working on permits and permanent residents who are in the Bahamas legally and paying into the program. N.H.I. has been proposed as a means of providing universal access to affordable health care for Bahamians.
We need another form of insurance. And that is where this comes in.
Parliament passed an N.H.I. bill in the final months of the previous Christie administration, but no regulations were ever finalized. On the campaign trail in 2012, Dr. Gomez promised N.H.I. within the first year of the PLP government. Today, Gomez said government still intends to implement national health insurance by January 2016. The government has engaged Costa Rican accounting firm Sanagast International to come up with the cost. In early May, Dr. Gomez told our news team the report was due by mid-July, but today he revealed it will now be completed at the end of the month. Without that report, Gomez said there was little that could be revealed, including a new calculated cost for N.H.I.
That's what we're waiting for the report.
N.H.I. was previously estimated to cost $235 million annually, but officials have said early estimates suggest that the initial cost has increased significantly. Meantime, health officials also addressed concerns about how national health insurance will impact private insurance. Chief Medical Officer Dr. Delon Brennan says it's too early to tell how N.H.I. and private insurance will overlap. But he says officials are working hard to ensure everything goes smoothly.
We know that our population needs. We know there are still issues to be worked out, and the community, being the intelligent community that it is, will ask those questions about those details. And so what we're hoping to do over the course of the next few months, as we develop more of an implementation of what we expect to be able to deliver, is to be able to answer those questions as we go along. The expectation is that as we begin to develop more of the plan based on what we get from our consultancy, our discussions with our medical practitioners, and the inclusion of the insurance industry as well, the expectation is we will develop something that will be comprehensive in its approach and how it's done. We know that we have a very robust both public and private healthcare system, and what will end up happening is we know we have a very robust public or private health insurance industry as well. So our discussions will include the industry in the way we begin to develop this.
Meantime, Gomez, Brannon, and other senior health officials participated in a seminar on national consultation on universal health care coverage at the British Colonial Hilton this morning. At the seminar, those officials, along with representatives from the Pan American Health Organization, reviewed N.H.I. strategies. Reporting for NB12, I'm Jasmine Brown.
In other news, police this morning on the scene of the country's latest murder. The body of a man with gunshot injuries was discovered lying in the street on a bushy tract road off Cowpen Road South. According to Superintendent Paul Roll, police received reports about the incident shortly after 9 a.m.
Officers responded to this scene where they met a male lying in the street suffering from what appears to be gunshot wounds about the body. EMS also visited the scene where they examined the male and pronounced him lifeless.
Roll said the victim, thought to be between the ages of 30 to 35 years old, was shot to the torso and his body was not there long before discovery.
The body, it appears, would have been there this morning. When officers arrived here on the scene, rigor mortis had not yet set in. So it could not have been more than 6 hours or so. As you notice now, some 5 hours later after being out here, this rigor mortis has already begun to set in.
Roll said police had no leads as yet and had not yet identified the victim. The victim was wearing jeans, a tan-colored shirt, a black watch, and green, orange, and white tennis shoes. He also had a beard and a Young Money tattoo on his stomach.
This male, he is slim-built, has a full beard with a tattoo across his stomach. Do you remember what's the
Young Money.
Young Money tattoo saying Young Money? And so I'm certain someone would have a relative that has a tattoo of Young Money on his stomach. We appeal to you to reach out to us and let us see if we can advance this investigation.
Roll appealed to anyone with information on the incident or anyone with a missing relative matching this description to contact police. According to Nassau Guardian records, this would be the 65th murder for the year. Well, opposition leader Dr. Hubert Minnis is calling on Prime Minister Perry Christie and his entire cabinet to resign and call an early election before the administration, quote, destroys the country. Minnis told our news team the Christie administration's record of poor judgment and governance has placed the Bahamas on a path to disaster, and a laundry list of bad decisions by the Christie administration has led to a loss of confidence among the public. He named the hiring of VAT consultant Ishmael Lightbourne as one bad decision and the hiring of BAMSI consultant Omer Thompson as another. Minnis also named the appointment of BEC Chairman Leslie Miller and the unsuccessful appointment of Elliston Ramin as Washington ambassador as further examples of what he called poor judgment. He also criticized the reported signing of a more than $600 million energy plant with Stellar Waste to Energy Bahamas by a parliamentary secretary. He also again slammed the administration for ignoring the results of the gambling referendum. Minnis said the blame for all these instances rests at the feet of the Prime Minister, adding the entire government must answer the people and remove themselves. PLP Chairman Bradley Roberts responded to the opposition leader today, stating Minnis is at least 5 years late in calling for the resignation of the Bahamas cabinet, as it was the F&M who placed the Bahamas on a clear collision course with economic disaster. In a statement, Roberts said under the F&M government, the recession was exacerbated locally with unemployment doubling and no net jobs created. Roberts said it was under the opposition leader's watch that government revenue deteriorated, the debt spiraled out of control, tourist arrivals plummeted, businesses were forced to shut down because of poorly executed public works, and no meaningful investment project was attached to the Bahamas. In addition to multiple downgrades of its sovereign credit rating during the Ingram administration, the party chairman said the deleterious effects of the F&M's poor stewardship ricocheted throughout the country months after the departure, when Standard & Poor's downgraded the Bahamas because of the policy decisions of Dr. Minnis and the F&M government. Roberts added that Minnis needs to be more concerned about immediate problems and turmoil within his own party and the threat to his leadership rather than an early general election.